Hey everyone, I am Nikul Parmar and I am going to take a demonstrative lecture on the disease hemophilia. So we will start with the definition. It is an incurable hereditary bleeding disorder in which there is a deficiency of the clotting factor in the blood. So when a person gets hemophilia, he or she can get bleed easily. So we can say that the hallmark of the disease hemophilia is bleeding. There are mainly three types of hemophilia: hemophilia A, hemophilia B, and hemophilia C. Among them, the most common type of hemophilia is hemophilia A. It is because of the deficiency of the clotting factor 8. And when there is a deficiency of the clotting factor 9, it is hemophilia B. And when there is a deficiency of clotting factor 11, it is hemophilia C. Now we will talk about the severity of the disease hemophilia, which is mild, moderate, and severe. Mild hemophilia. People with mild hemophilia may not have any symptoms until an event occurs, like skin or soft tissue wound. Joint bleeding is very uncommon in the mild hemophilia. Whereas we talk about the moderate hemophilia, this kind of patient is detected very easily, and the children with moderate hemophilia bruises easily. After falling or any injury, there are some symptoms like internal joint bleeding, which is common in moderate hemophilia. And the joint which are more prone to bleeding are ankle joint, knee joint, and elbow joint. So because of the joint bleeding, there are some other symptoms also take place. For example, pain, irritation, tingling sensation in the joint, as well as hematoma formation in the joint and the joint stiffness when it is untreated, and the affected joint become warm, swollen and tender. Severe hemophilia. The symptoms of the severe hemophilia is similar to the moderate hemophilia, but they occur more frequently and more severe. The child is bleeding for no specific reason. Some other symptoms of the severe hemophilia may include joint pain, joint swelling, unexplained bleeding, blood in the stool and urine, unexplained bleeding from the nose, and joint tightness. We have seen symptoms regarding mild, moderate, and severe hemophilia, but the most common feature is joint bleeding. This bleeding is very much painful and it can lead to the formation of the inflammation. And because of the inflammation, there is a decreased mobility, there is an ADL difficulty, as well as long-term deformity take place. And because of that, some complication in the joint also take place. For example, joint contracture, deformity. The patient of hemophilia may get early osteoarthritis, muscle weakness and atrophy, and there is a formation of the hematoma in the joint. So because of the hematoma formation, the peripheral nerve compression is also take place, and there is a decreased aerobic fitness as well as difficulty in the ADA. So now we will talk about the management of the hemophilia disease. The medical management include the replacement of the missing factor by the recombinant factor and desmopressin. Physiotherapy management. Physiotherapy play very much important role in the patient with hemophilia because physiotherapy can improve the quality of life by minimizing and preventing the deformity as well as educate the patient and children's parent about the disease and protecting the joint. Now, what is the importance of exercise in hemophilia? When you do the exercise, you will get strong muscle, good flexibility, good extensibility, good coordination, reflexes. So ultimately, you will increase your joint protection and there will be the quick recovery time after the bleeding. So patient can continue with the normal healthy life. One thing we have to note in mind that we cannot use any kind of thermotherapy in patient with hemophilia because it can causes vasodilation of the vessels and there will be the bleeding when you have already bleeding, so it will not helpful. To prevent the contracture, we can use manual traction, mobilization, dynamic splinting and active range of motion exercises. To maintain the strength, the strengthening exercise which include isometric strengthening exercise, hydrotherapy as well as progressive resisted exercise. And when there is an acute bleeding, you can use the RICE protocol, which is rest, ice, compression and elevation. Some things that patient should have to take in his mind that he or she should have to do the exercise regularly, which is prescribed by his or her physiotherapist. Practice good dental hygiene, avoid heparin, warfarin or any kind of anticoagulant drugs.